We'd also like to welcome Manuel Delgado, master luthier and owner of Delgado Guitars, and Derek Moore, partner at Slim & Huskies. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, everyone. 10 years ago today, a hard rain fell on Nashville. Over the next 2 days, a 1,000-year flood, sparked by 13.5 inches of downpour, inundated our city and shaped and reshaped the future of Davidson County forever. Flooding first occurred at Mill Creek and eventually cresting at over 21 feet and quickly spreading across our city, destroying and damaging homes, businesses, and iconic Nashville landmarks, including the Grand Ole Opry House, Bridgestone Arena, the Titans Stadium, and Schumerhorn Symphony Center. All told, nearly 11,000 properties were damaged or destroyed, and 10,000 Nashvillians were displaced from their homes, resulting in $2 billion in private property damage and $120 million in public infrastructure damage. Our city lost a great deal in the flood, and none more devastating than the 11 Nashville area residents who died as a result of the storm. Today, we honor their memories and extend our deepest condolences to their families and their friends. Now, those dark floodwaters would eventually give way to an outpouring of neighborly love and support. And collectively, in that disaster, Nashvillians donated 91,000 hours to recovery and restoration efforts and more than 1,200 volunteer projects through Hands On Nashville alone. I'm also grateful to the courage and exceptional heroism of our first responders and the tireless efforts of our Metro employees in the aftermath of the storm. Throughout the flood response and recovery, our community rallied around the phrase, "I believe in Nashville," words that still today demonstrate the solidarity and spirit that Nashvillians have always shown in times of tribulation, and words we need to draw upon again. I encourage you to continue your efforts to protect each other and remember what we've overcome in the past by working together. Our strength is our community. Now, this morning, I want to remind everyone that our latest public health data shows that Nashville is on the right track to safely restart our local economy. We are closely monitoring our multi-part criteria to start phase 1 of our economic reopening strategy. Phase 1 will enable local restaurants, bars that serve food, retail establishments, and commercial businesses to open at half capacity while maintaining social distancing protocols and protecting public health. Remember, a safe, balanced approach to our economic reopening strategy will help us avoid a false start. It will put us all in a position for long-term success. The public health consensus is clear. Each additional day we maintain our safer at-home protocols makes it more likely that we do not lose our hard-earned progress. We need a sustained economic recovery without interruptions. Our students and educators, global tourism industry, seniors, and medically vulnerable populations are all depending on an early return to safe conditions without a relapse throughout Davidson County. As a reminder, you can visit covid19.nashville.gov to review Metro's COVID-19 dashboard, which displays several important public health metrics in an easy-to-read format. The Metro COVID-19 dashboard includes our coronavirus transmission rate, the 14-day new case trend, public health capacity to conduct contact tracing investigations across Davidson County, and COVID-19 testing capacity, as well as the hospital capacity with both regular beds and ICU beds. As a reminder, order number 4 has been issued by the Metro Public Health Department, and I want to encourage everyone to wear face coverings whenever you are out in public, per CDC guidelines, to slow the spread of the virus. Protect yourself, your loved ones, and those around you as you run essential errands by using face coverings whenever you leave home. Now, this morning, I want to welcome Manuel Delgado, master luthier and owner of Delgado Guitars. And Manuel joined our office yesterday afternoon as a featured panelist in a webinar for small businesses to discuss how local employers are preparing for our phased economic reopening and to protect both workers and consumers in this era of social distancing. Thank you, Manuel, for joining us today. And I also want to welcome Derek Moore, partner at Slim & Huskies, who was a featured panelist during yesterday's webinar for restaurant owners and operators. I'm grateful to have Derek with us this morning to discuss all the ways that hospitality business owners are preparing to safely welcome dine-in customers while protecting the well-being of their employees. And as always, I urge you to visit Metro COVID-19 website and consider donating to the COVID-19 Response Fund. There you can also learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Jahanger, the chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We had an additional 2 deaths yesterday, an 85-year-old woman and an 87-year-old man, both of whom had underlying medical condition. My sympathies go out to their families. The total number of fatalities is 27. We now have 2,832 confirmed cases. That's an increase of 163 cases in the last 24 hours. There are an additional 3,227 cases in the surrounding counties. That's an increase of 955 in one day. Now, for the first time, the surrounding counties have more cases than Davidson County. The total for our region is over 6,000. Of the Davidson County cases, 1,339 are currently active, and 1,466 residents have recovered and have been cleared. The 163 new cases in Davidson County is concerning. However, we need to see the data over the next several days before drawing any conclusions. Today's dashboard shows that the transmission rate and the 14-day trend of new cases both continue to be yellow or less than satisfactory, while the other 4 metrics are green or satisfactory, including our public health capacity, hospital bed capacity, ICU capacity, and testing capacity. To see the dashboard and to look at any additional data, go to covid19.nashville.gov. Now, we have taken steps to expand our already robust testing capacity in the city. As of today, the community assessment centers will be open 5 days a week, each Monday through Friday from 9 a.m. to 3 p.m. In addition to this, we are finalizing plans to have mobile testing teams that can respond to long-term care facilities and other places that may need testing, as well as conduct pop-up testing in different areas of our city. Now, these additional testing resources are important as we plan to reopen the city. Residents will need to have easy access to testing so that we can closely monitor the spread of this virus. Today, all 3 community assessment centers are open until 3 at Nissan Stadium, Meharry Medical College, and at the old Kmart in Antioch. So far, we have tested 1,600 people this week at our centers, and nearly 7,000 people have been tested since we opened on March 31st. Also, our assessment hotline is open today and every day from 7 a.m. to 7 p.m. Please call 615-862-7777. If you think you have the virus, or if you think you've been exposed to the virus, or if you're just worried about the virus, please call our hotline or go to one of our assessment centers. It's always free to you, and you will be assessed and tested by a medical professional. Now for an update on our situation at the fairgrounds. Earlier this week, as I mentioned yesterday, 4 individuals at the fairgrounds facility tested positive. Our contact tracing investigative team from our public health department recommended and resulted in us testing all residents and staff there. That testing was completed completed yesterday. Further investigation showed that some of these individuals may have been at the Nashville Rescue Mission also. So yesterday and early this morning, we tested nearly 400 other individuals at the Nashville Rescue Mission. Now, we know this virus doesn't treat everyone equally. That's why we have to protect the ones who this virus impacts the most, our elderly and the medically frail. Those over 65 and those with underlying medical conditions should stay at home. If you have loved ones in this category, encourage them to stay at home. Run the errands for them if you can. And as difficult as it may be, they should not leave their homes. For anyone who does have to go out, please protect yourself and others. A face mask and covering at all times. This shows you care and are doing your part to fight the virus. Now, I know the city is counting on the mayor and the Metro Coronavirus Task Force to work hard to get the city back open, and I can assure you we are doing just that. But Nashville is also counting on you. You need to stay focused and stay at home. We'll get through this, Nashville, and we can get through it together. I now would like to introduce Mr. Manuel Delgado, owner of Delgado Guitars. Thank you.
Thank you, Mayor Cooper, and thank you, Dr. Jahangir. I want to also thank Chief Swan and Dr. Caldwell and just all of the leadership for Davidson County and how they're working hard to try to make sure that our small businesses, all of our businesses, can reopen again in a safe manner. I can assure you, as the owner of a family business that dates back to 1928, 92 years, I feel the anxiety and the fear that is associated with having our businesses closed right now. But that being said, right now, smart business is safe business, and we have to try to figure out a way to prepare. Start planning now how you're going to open your businesses, the things that you can do to not only keep yourself, your family, your staff healthy, but your clients as well. No business is worth endangering the health of the people that we care about. So please take the time right now. Think about the ways that your clients are going to be entering, exiting. Every business is going to have its own nuances and differences that they have to deal with. I mentioned this yesterday in the webinar. If you're a business that sells items that people would need to touch and look at before making a decision, try to minimize those things. Have things available, perhaps rubbing alcohol or a way that people can wash their hands prior, if that's a possibility. Signage on the door is very important. We've done that at our business where we're asking people to contact us prior to opening the door. We have our phone number posted. If people do not have any face masks or coverings, we're actually offering one to them. Every business is going to be unique, but again, this is just an example of something that we're doing and what we're trying to do to not only keep ourselves safe, but think about our community. In times like this, when you're a small business owner, I think it kind of gives you the opportunity to show who you truly are and what it is that you stand for and what matters to you. So here is where it's important for you to show your community that you care and take the time to show them that you're doing the steps necessary to care for your community, to care for the people who work for you, your staff, and to care about what's happening in our city right now. We all want to reopen, but let's be an example to the rest of the United States and the rest of the world of what a smart city looks like when it does that. So I want to now introduce my fellow small business owner, the owner of Slim & Husky, Derek Moore. Thank you.
Good morning. I want to first thank the mayor, city of Nashville, for allowing me to come up and have this conversation with my peers in the city of Nashville. It's very important for us to follow the guidelines. The data-driven versus time-driven phases are pretty important, and I think it's the best way for us to reopen the city. We're seeing cases decline, spike, move around, and it's important that we just stay strong as a city, stay strong as business owners, start to create policies as far as reopening and getting ready to get back to work. Encourage the employees on the front line, which is the restaurant employees, your grocery store employees, to stay safe. Encourage hand washing, cleaning of high traffic areas, wearing face masks. Encourage your customers to wear face masks. Encourage hand washing hand sanitizer. Just do all you can to keep everyone safe. As a community-based business, we're always thinking about our employees as well as our customers, and it's very, very important for us to keep everyone in mind when it comes to reopening and getting back to work without, like the mayor said, without any interruptions. Once we get to phase one, we definitely want to move to phase 2, 3, and 4, and that's the goal. And the only way we can do that is if we follow the guidelines that the CDC, state, local government has laid out for us. And it's very, very important for us to get back. And you know, I know those small businesses out there as well as us, you know, we're ready to get back to full capacity. But the only way we can do that is to follow the guidelines, stay safe, and just be encouraged.
Thank you, Mr. Moore. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Julia Palazzo at WKRN. Julia?
Good morning, everyone. Thank you. 2 questions. My first for Dr. Jahangir. When Governor Lee visited the White House this week, he talked about Tennessee's plans to test every staff member and resident of a long-term care facility. Have you spoken with these facilities about how this will work in Nashville, or will this be just handled by the state? And then my second question for Mayor Cooper, I'm sure you've been hearing from a lot of businesses over the last 24 hours regarding the extension of the order. And I know one reached out and said postponing this for another week is not going to make any difference in this situation. What's your response to that and business owners who are writing open letters about their fears and their struggles? Thank you.
Thank you, Julia. Dr. Jahangir?
Julia, thank you so much for that question. In fact, late last night and early this morning, I've exchanged several emails and maybe even text messages with people from MDHA, from the Department of Health of the state, and the Unified Command regarding the LTAC testing. Great thing is MDHA had already taken, MDHA is obviously not an LTAC, but it's beyond just the LTACs. We are looking at harder to reach communities. So there is a plan that we're working through. We have a list of several facilities, and we're looking to expand that list. We have a plan which will include a private lab for tests, staffing from both us as well as the state initially, and then subsequently the strike teams, the mobile teams I've discussed. And we're going to roll that out, I think, that at earliest maybe in the next week or 2. But we have had those dialogues. We're strongly supportive of that, and we will continue to get our residents in our city taken care of. Thank you.
Thank you, Julia, for your question. My message to businesses is don't waste what we've done. This has been very hard. This progress is painfully won. It's with enormous sacrifice by businesses and by individuals. Don't waste what we've done. I think experience in other countries has shown if you've been effective at social distancing protocols and you're really at it, you can reopen, hopefully safely. Nashville, unfortunately, has more than 150 cases today. So we're in a better position than we had feared we would be today, but we are not out of the woods on this. I mentioned yesterday an analogy in my mind which sounds harsh, but I think it's right. It's that last round of chemotherapy. That last round of chemotherapy may produce better long-term results, and that's what we're trying to do. It's a balance. It's a balance because the cure is sure terrible. But we're sympathetic to businesses and individuals, and it's unthinkable that we really have to ask people to do this, but keeping each other safe and being positioned in the best possible way for the phase 1 restart is what we need to do.
Harriet Wallace at Fox 17.
Yes, good morning. I do have a question regarding, face masks. There is now a strong encouragement of wearing face masks that will be part of the requirement as businesses reopen, yet we have a shortage of those supplies. any concerns about how this will impact the curve, knowing that there will be a requirement or strong urging for masks, but there's a shortage of masks? And then secondly, are there any funds, maybe from the stimulus money, anything that can be used to assist in buying masks, especially for those who are on the front lines of this virus that desperately need them? Thank you.
Thank you, Harriet. Dr. Caldwell.
Good morning. You're right. Now that we're going to be requesting everyone to wear face masks, we want them available. We want to encourage you to go to the COVID-19 website, because on there, we're trying to encourage people to make their own masks. They're very easy to make. You could just use a cloth face covering, and that's the easiest thing for people to do. In addition, we are going to be trying our best to continue to supply as many face masks as possible, but main message is please try to make your own mask. I'll ask the Mayor to answer the second question.
Yes, funds for health equipment for businesses reopening, yes. It'll be made available, and to contact the Public Health Department if you are not able to provide it for your own staff and employees. And we will work with the state to add to the capacity so that it is available. This is part of our shakedown cruise to get ready for phase one, for businesses to evaluate what they in fact need, and then to contact public health, and we'll contact the Unified Command to help get them what they need. This is why every day I'm grateful to our small business partners for reaching out and communicating to small businesses, and to our large business partners. Get this right, work through what you're going to need in this phase in order to get reopened successfully and safely.
Nancy Amons at WSMV.
Good morning. Thank you. I have two questions. The first one is the comments about more. This is the first time that surrounding counties have had more cases than Davidson County. What are the thoughts on whether this is because of the relaxed guidelines or just more testing in the surrounding counties? And the second question is about the fairgrounds. You have some folks that tested positive. What measures are in place to keep the people who are infected from leaving or from mingling with others? Is there security? And this is a population that I'm sure is very sensitive to being locked down. Thank you.
Thank you, Nancy. Dr. Jahangir.
Nancy, thank you so much for those questions. Regarding the first one around the 955 increased cases, which I think is a single-day increase, you know, I've spoken with some of the people of the State Department of Health. I believe they may address that later today, but I think this will be shown to be a cluster of a group of people. And if that does hold true, I think what is important to point in that is, as we've always said for Nashville, we're always going to look at all the metrics. If we have a cluster down the road and that may spike our numbers, we need to look at, is there community spread? And or is it an isolated area that public health system kicked in real quick and protected the community from? And so I will let the state answer exactly where it is, but I think it's looking more and more that it is an isolated incident or two, and that explained that number. Regarding the fairgrounds, just to remind everyone, there are two facilities, about 100,000 square feet in total. Traditionally, we had a facility for unhoused individuals that are well, so no symptoms, no evidence of illness, in one facility. We have a second facility that has places for people who are under investigation, so they had a test conducted but are waiting results, or who have tested positive. Now, to answer your question, right now, if somebody has tested positive, they are under a quarantine order, and so they actually will be kept at the facility. There's protocols for that, but there is a formal quarantine on that individual, which allows us in a public health emergency to have someone remain at the facility and not leave, and that protects the public. Thank you so much.
Chris Davis at News Channel 5.
Questions. The first, the SEIU healthcare workers used to release this morning about the lack of PPE gear at HCA hospitals. Have you spoken to HCA about this? Is there anything that the city can do to help with that? And then secondly, you have said this morning that we are on track for reopening, but we also saw a higher case count today. So are we still on track? And is the hope that we might be able to do some sort of phase 1 May 8th opening, or where do we stand on that?
Chris, do you mind repeating the first part of your question, please?
Sure. The SEIU Healthcare Workers Union sent a release this morning about a lack of PPE gear at HCA hospitals. Have you spoken to HCA about the issue? Is there anything the city can do to help if it's an access to PPE issue?
Thank you. Dr. Jahangir.
Yeah. So regarding your first statement, it's the first time I've heard that. I think HCA is one of the largest hospital systems in the world, and they have a very capable supply chain, and I've deferred to them to answer that question. And I'm sorry, the second question, I slipped my mind. I apologize.
Chris, will you repeat your second question, please?
Oh, I got it.
Sure.
I got it. It's the spike in cases, and are we on track? In short, this is day one we're in a 14-day trail, right, or trend. And so as we've always mentioned, not a single day of up or down will determine what happens. We're looking at multiple metrics, and we are just looking at multiple metrics, and that's why we're looking at the trend line and not a single spike up or down. And so we'll continue to monitor. Obviously, we'd like to have it be lower than that, in lower trend every day, but I think we've seen how this works. Sometimes the days will be up, some days will be down. Our hope is that as we move on the next several days, we'll have a better sense where we are. But again, the science and the data will drive this decision and not a date specifically. Thank you.
Thank you, Chris. Our final question is from Kara Hartnett at the Nashville Post. Kara?
Hi, thanks for taking questions. On the expanded testing, is this to meet demand, or do you want more people to seek testing as we're re-entering? Can you just talk about the strategy behind that? And then what type of testing are we just doing the typical testing? Or are we going to expand into antibody testing? What are you guys thinking about that?
Thank you, Kara. Dr. Jahangir?
Garrett, thank you so much. So the demand has, we've been able to meet demand, right? So as we've discussed previously, there's been no, long lines. We're able to keep up with it. Now, as we look to reopening our communities, I think it is important for us as a city to be able to even expand our access to tests to anyone. So if somebody goes to their small business and we're asking the small business to screen their employees, and if an employee shows up having a fever or symptoms, we want to give a resource to our colleagues who are really helping get our community started again to go and get a test, and so they can just refer them to all of our community assessment centers. So part of this is, as we start reopening, I think increased testing capacity is one of our metrics. Right now we're in green. We want to continue to get that strong. So that's the reason we're expanding. Regarding the test, the test you use to diagnose that you are actively infected is the PCR test, which looks for the virus. That is, as I believe you mentioned, the typical test. That is the nasal swab test. That is the test that we're going to be giving. Antibody test, while long-term will be a really important indicator of how much we have immunity to this and across our community. Acute testing, the best way to know you have the virus is the PCR test that looks for the actual virus. And that's unfortunately, they're not so comfortable swab up the nose. But that's what that test will be. Thank you so much.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Manuel Delgado and Derek Moore for joining us today. Live press briefings will resume on Monday, May 4th at 9:30 a.m. As a reminder, you can visit covid19.nashville.gov for up-to-date information on Nashville's coronavirus response. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.